everyone. I am Dr. Marlon Johnson, Assistant Professor of Counselor Education at Seminary of the Southwest here in Austin, Texas. And I am delighted to be one of the presenters this week for the I Deserve World AIDS Conference. It's an honor to be a part of this conversation and to speak to the title Let It Out, Exploring Mental Health and HIV Care. It seems really important to me that as a licensed professional counselor myself and a counselor educator, that it's important to have these conversations around what is mental health and how does everyone in their own individual experience and embodiment engage in this world of psychological wellness and healthcare. So before I really get started, I should probably talk a little bit about who I am so that you kind of understand my situation in this particular presentation. Like I said, I am a professor at a small seminary in Austin. And part of the joy of that work is being able to function in this setting where I'm integrating continuously the sacred and the secular, where we talk about the theological underpinnings of health and wholeness, while also engaging in the deep psychological science that goes behind behavior and neurotransmitters and all of the different things that a counselor is going to encounter. When it comes to my research and my work, I like to tell people that I work from the 4 R's, which is race, rurality, religion, and recruitment. So of course, race, I talk about the experiences of Black individuals as they are engaging in counselor training. Rurality, I did a lot of work with career development inside of rural spaces, whether that is rural Appalachia or the middle of South Carolina and their rural experiences. And now working with a couple of individuals who will be transitioning to the East Texas region for counseling and counselor experience. So how does rurality impact all of that work? Then we think about religion and the experience of both religious hurt and church hurt, as well as spirituality as an integrated form of counseling and an integrated space for individuals to get the emotional and psychological healing that they need to persist in this world. And then we have the last R, recruitment. I learned very early on that it was important for me not just to be a counselor and a counselor educator that seemed to have found my way through the ranks, but to recognize that that experience was intentional, and that in order for me to be here, it took many different steps and my own personal narrative of engaging in messages around what it meant to be mentally well and what mental wellness is. All of those narratives came together to bring me here and to bring me to a space to talk to you all. And it sounds really interesting when you talk about those 4 areas in their own specific silos, but when we think about today's topic, all of those experiences come together at once. When we talk about HIV care and mental health, well, for a lot of individuals, especially for Black and queer people of color who may have any connection to HIV, whether it is they are simply a queer person that is just engaging in learning their identity and separating those messages of what it means to be queer and the stigmas of sexual behavior, or if it's about the known statistics about Black bodies having higher rates, higher infection rates, and more diminished treatment responses from healthcare providers, or even the stigma of race and religion having an impact upon one's own psychological state as you engage in the experience of having a positive HIV status and then bringing that forth to trusted leaders for support and care. Everything that I work on and work towards is to, in hopes, help the practitioner as well as the patient feel somewhat more comfortable and better prepared to engage in this deep and wonderful work of mental health and wellness and creating a space of psychological stability. And so I have a couple of questions that I'll be walking through today with you all. And my hope is that as I walk through each of these questions, that we get a little bit grounded inside of both the historical context of mental health and wellness and HIV care, and how that then impacts us today, and my strategies and suggestions for individuals who are patients, practitioners, as well as partners who may be supporting individuals who are navigating their mental health and their wellness when getting news about HIV and your HIV status. So, what is mental health and what all does it include? I noted earlier that I am a licensed professional counselor. But mental health and acquisition of mental health comes from many different perspectives and many different worlds and fields. The world of psychology and psychiatry might take a slightly more medical perspective on what mental health care is. It may define mental health care from the experiences of distress and impairment that an individual experiences to their day-to-day functioning. A psychiatrist may observe how there are neurochemical imbalances that may impact one's ability to engage or to provide or to move forward with their day-to-day functioning. And so a biological or a pharmacological intervention may support them in being able to do their day-to-day functioning. A psychologist may be able to provide some assessment, some additional support that still works from the same medical model of looking through the neurotransmitters or biochemical reactions, but will specifically focus on how to support an individual when deficits of functioning appear. Social workers are also really well skilled in being able to engage with the client as individual, but the client as an individual and a part of a system. So social workers may be able to support a practitioner or a client with their wellness needs, their mental health care, as well as supporting them with connecting to different resources, connecting with different community partners, finding different ways to understand and pathologize the individual from a broad or large systemic approach. And then we have mental health counselors. And professional counselors often take a strengths-based approach, which is very similar to what a social worker might engage in. And professional counselors look at mental health care first from the strengths that an individual may have and how the access to those strengths that they bring into the clinical room shifts and changes based on the distress that they've encountered in their life, whether that be their work conditions have significantly changed. They're encountering a global pandemic and the stress that comes with adapting to a completely new world. Or perhaps they've just gotten news of acquiring a virus that impacts the ways in which they might engage with their family or their nieces or nephews, and they just need to process what's happening in that space. And so mental health counselors are also doing this work to support the individual, to highlight their experiences, their strengths, to acknowledge the discrepancies inside of their experience, and to walk alongside them through a lens of, for me, in my experience, through a lens of looking at their stories and engaging in the injustices that have occurred in their world, and to acknowledge and highlight where there are moments that that they have encountered systemic injustice or an inadequate response to the crises that they've encountered throughout their lives. And so I've said all of this without actually defining mental health. Well, if you think of mental health, well, mental health is a part of the whole health system, where physical health may encounter your ability to breathe or to manage the pain that you experience in different systems of your body, the functioning of your different organs and systems. Well, imagine that mental health and psychological wellness is another piece of that puzzle, where I'm not necessarily seeing how strong you might be able to breathe into a tube, but I am going to ask you questions of, what does your chest feel like when you encounter an incredibly stressful scenario? And what is it like when perhaps your shoulders get tight or your face gets hot when someone calls you out of your name or says something to you that doesn't align with how you experience the world? And so I move away from just engaging in stress and distress and from deficits to looking at mental health as a facet of your global wellness, of all of who you are. And that wellness engages with the biological, right? So there are psychopharmacological interventions and biofeedback that might play a role inside of your work and play a role inside of your overall wellness. But then I'm also going to look at the social aspects, the systems that you function in, whether it is the microsystem of you interacting with your neighbors, your family, your peers, all the way to those macrosystemic experiences that involve political policy and your neighborhood resources and the community leaders and liaisons that impact even the small things as getting to work on time. And then I'm also going to talk about the psychological, what's going on internally, inside of your internal world. And how does that pick up into your identity and the development of your identity over time with different interactions with individuals. And so I also work from a queer lens and a spiritually integrated lens. So when I say that, what I'm anticipating is that when I look at my client, I don't just see a young person, a Black person, someone who identifies as male, someone who identifies as transgender, but I'm looking at all of those identities. And for me, their identities are not just a disruption of them being either male or female, either cisgender or transgender, either queer or not queer, but I don't function in a binary. Instead, as we go throughout our lives, and when I look at our mental wellness, we're building our identities from multiple layers, that we're looking at how I experience my Blackness, my queerness, my identities, all through these experiences and narratives that I have encountered throughout my life. What it means to be queer and Christian, what it means to be male and Black. All of those things interact with one another. And through those narratives, I begin to filter my identity, right? So what I've heard about being male and what I've heard about being Black, I filter how I might encounter someone who doesn't have those identities, who may experience the world differently than me. And what I've been told about maleness, blackness, queerness, Christianity, I then perform based on the spaces that I live in. And so when I look at a client and someone comes through my door, I'm swirling with all of those things happening all at once. And so I look at that biological, the psychological, the social, and the spiritual aspects. Even if that client isn't particularly connected to a religious tradition, I imagine that there's still some search for meaning and sacredness and purpose that drives that client to move forward and to want to do something next and to continue to live a life that they find fulfilling. And to me, that quantifies that spiritual context. And so I've talked about mental health, I've talked about my particular perspective and my worldview and my role, but what I haven't really said is how does this queer biopsychosocial and biopsychosocial spiritual development perspective connect to mental health and HIV care? Well, as I talk about wellness and mental health, I'm engaging in this process of realizing that we're all developing, right? So we're developing these identities as time and as life moves on. And so when I look at this framework and I look at these different lenses and I look at the narratives that my client has been clawing their way through over life, I'm really going to look at how they have developed their identity around sex and sexuality, gender, and perhaps even their spiritual identity. So a couple of frameworks that help me to understand development. One of them is from a early model of spiritual identity development from when I said the search for the sacred, that's one of the frameworks from an author named Pargament. And what Pargament said is that as an individual goes through life, they kind of have three different spaces of their spiritual identity development. And it starts with discovery, right? So we, as young individuals, we kind of discover that, there is a world outside of ourselves. And this world is beautiful and vast, and there's lots to explore and experience. And where did it all come from? So in discovery, the individual is starting that process. And once some traditions, some beliefs, some ideas start to crystallize and solidify, you enter into the space of conservation. And so in conservation, we're beginning that process of thinking about who we are, where we're going, where we're headed. And it's all starting to come together to crystallize for us of, well, we encounter something that maybe doesn't align with who we are or what we realize, but that's okay. I still have this core sense of belief. But when we start to encounter things that jostle us just a little bit, well, it can lead us to a spiritual crisis, right? Where our spiritual coping doesn't quite add up. The ways in which we've been able to stabilize and conserve our identity doesn't quite fit. And so we enter into the space of transformation in our search for the sacred. And when we enter into a stage of transformation, we start seeking out support from other individuals, from people who are spiritual leaders, whether that's a mentor or a family member, an elder inside of our community, to help us to understand this critical experience that we've had that shifts or changes our experience with how we've made meaning of our lives, of the greater world around us. And a lot of times when we are thinking and we've encountered our experiences with HIV with sex and sexuality, it can shift that way in which we've encountered things that are sacred to us. Family traditions look different, right? Our ability to communicate with particular communities changes and shifts drastically. Once we start to discover and to engage in exploring our identity of maybe being queer, or perhaps our status changes, or even that we are in transition from being seropositive to being seronegative and undetectable. And we're having to navigate, well, what does this then mean for this meaning of my life that maybe at one point in time I didn't think I had many more years to live, but now I do. And so Parliament would say, again, that's a level of transformation in your spiritual search for meaning and for life and how that changes. I also want to engage in this intersectional idea of identity development when we look at sex and sexuality. Now, when I say this, hear me very clearly that I'm not just talking about individuals who identify within the queer spectrum, right? So we all kind of develop this sense of sexual selves throughout our lifetime. And so as an individual is engaging with their understanding of their own individual identity, what they like, who they like, their sexual orientation, their affectational orientation, all of those things are having this individual reckoning and understanding of these things. You're also going to compare that back to this social identity that you're developing. So for my heterosexual siblings, you may be recognizing that although you might have a particular orientation or affectation towards a group of people or an individual, you might also realize that the ways in which you engage in trying to seek out a partner or communicating that experience to fit in with a normative experience of what it might mean to be heterosexual, that might also conflict with your own experience. And so Dylan would say that as we are experiencing our sexual selves and we're beginning to develop both this individual and this social identity, we're constantly being put up against lots of challenges in our active exploration. Maybe it's the first time that you have felt someone make contact with you that wasn't just about a gentle hug or a warm embrace just to say hello. Perhaps you're finding yourself engaging in a sexual activity that felt taboo at one point in time. All of that is us taking in new information and helping us to better understand how we might be able to engage and explore and experience our sexual selves. And so both in Pargament's model and Dylan's model, we realize that there's not always positive experiences, right? Like our mentors don't always give us the best information. Our healthcare providers don't always give us the greatest amount of support. Not everyone is able to handle the heaviness of our active exploration. And so if we begin to have some negative experiences, it can kick us towards, in Dylan's model, diffusion, where we don't exactly want to engage in or be a part of a particular community. We start to disconnect with what feels healthy and whole for us. We may even try to avoid a public experience of ourselves and our bodies because of the amount of shame or hurt or pain that we've experienced when we begin to communicate to other people about our exploration or our status. And then Pargament would say we begin to disintegrate upon those negative experiences, that our connection, that our desire, our motivation to explore our spiritual selves or our healthy selves, our healthy lives begins to pull away from that exploration. In fact, we begin to disintegrate from the leaders, from the mentors. And in some ways, it could be very healthy if they're being harmful to us. But it also closes us up from being able to explore and to make meaning for ourselves when critical changes happen in our lives. And so when we talk about HIV and HIV care, when an individual has this transformational experience, or when they're in this act of exploration to try and gather information for themselves, it's important for them to also have experiences to explore, what does this now mean for me? Who am I now as I try to understand what my status is? When I try to talk to my family members about it, when I go back to church and I lead a sermon and I speak to my community, my congregation again, how do I now make meaning of those experiences when I've heard all of these different layers and languages that say that I'm dirty, I'm broken, I'm unclean, I don't belong? And so it's really powerful to begin to think about it and to consider how this exploration and this experience and the restrictions or barriers might stop someone from being able to actually engage in this act of exploration. So my third question that I'm going to process with you all is, as you consider things like an HIV status or HIV care, how do we think about minority stress and minority status and see that as a facet of HIV care? And how does minority stress impact one's mental health? Well, to define it, minority stress is a term that comes from researcher Elin Meyer. And what Meyer discovered was that in a study of numerous gay men, they came up with an understanding that there was a different experience of psychological wellness just by having a different sexual orientation and sexual identity than their heterosexual peers. It was very binary back at that time. But as minority stress continued to expand, there's a recognition that individuals who had any level of power or privilege pulled away from them in the society that they lived developed this keen sense of an underlying bubble of stress that they were navigating through and managing throughout their lifetime. And on top of that, there was also this expression of resilience, finding new ways to explore and experience their embodiment in a world that didn't, at the time, want them to exist. And so a lot of times, for many communities, we found these additional ways to explore and experience, to help and heal from in a world that doesn't really understand how to support or to open up or to leave brave space for queer and trans and indigenous and black and brown voices to sit at the table and to express what experiences they're having as they're going throughout their daily lives. And so as we're thinking about and considering minority stress and both the ways in which it impacts our daily living, but as it also breeds more resilience, we also have to be mindful that it impacts our mental health. So when you are an individual who is encountering minority stress, you have to do additional cognitive practices as you go throughout your day-to-day life. Am I going to be accepted when I speak and I don't sound like someone anticipates me sounding? Are people thinking about the ways in which I might interact with them when I identify as a queer person? Are they looking at my black skin? Are they thinking about the texture of my hair and not really listening to what I'm actually saying? What if my boss realizes that I'm positive and that impacts the ways in which I get an evaluation? All of that stress plays a role in our mental health as we move throughout our days. And when we look through the minority stress model, it's important for us as therapists, as practitioners, as uh, leaders and liaisons to see ways in which that stress precipitates in our daily functioning. Now, I'll be honest, when Eli Meyer developed and did research in minority stress, it was a different world. It was the mid 90s, and there were a lot of different conversations around HIV and HIV care. We had just left the Reagan era where the United States had completely ignored and overlooked the incredible crisis that was happening around HIV. We had numerous organizations that were advocating for decades for people to stand up and to speak out against political pundits that would continue to erase how serious and how grave HIV was. And that this infection was continuing to surge inside of Black communities that were often not able to access some of the specific care that was needed just to stop the disease. And there were also lots of historical challenges with the narrative of HIV being a gay disease, that individuals who were most likely to be affected, Black women, weren't able to actually be seen as individuals who were acquiring the disease and were dying off in large numbers. Knowing this historical context can help us to recognize why HIV care has been so challenging for the patient to then disclose, to talk about their experiences, to be able to talk with confidence about what it means to be nervous about getting an HIV test, to be nervous about what it might even say to them, to their community, to their leaders, about what it means to potentially have a different status. And to know that there are multiple narratives that have gone out, and in particular, different Christian communities throughout the 80s and the 90s that have marred the ways in which we've been able to care for our HIV positive siblings. And so all of those messages, all of that history has compounded in our understanding of minority stress as it relates to HIV status. And then being able to consider that stress plays a role on you physically, but also psychologically in your ability to explore, to have conversations with your doctor, to invite in different experts, different leaders, different conversation partners about your health and your mental health. For a lot of us, let's be clear, mental health care hasn't always been financially accessible. And so still to this day, it comes to no surprise that I work in a field that can be very inaccessible without insurance. And the lack of opportunities for people to have access to mental health care is increasingly becoming more and more challenging. And so finding those spiritual leaders who maybe haven't been the most healthy persons for you in your past to be able to have those conversations with them about such a tenuous topic can even compound again in that intersectional lens of why it's so difficult to process what you're experiencing as you're understanding your status, as you're understanding how to navigate through the rhythm of life from day in and day out. So my last question, my last wondering is actually a call to action as we're thinking about our roles as mental health practitioners, as people living with HIV, as we think about partners, as we think about even being family members. What can we do to advocate for and to develop accessible space for mental wellness and psychological healing? Well, to my fellow practitioners and as well to spiritual and religious leaders, it's important for us to recognize the impact of identity and culture as it relates to our client or our parishioners' process of experiencing their status. We can't just assume that the status is their most salient identity or that it's even their primary concern, but we also can't be afraid to have conversations about it. It's important for us to be able to actively broach the conversation when they bring it up to us in courage, and to not just look away or deny or talk around or speak about morality politics in that moment. What that person needs from you most is your attentiveness, your ability to hear and to listen. And so I encourage you to take that stance and to think about all of the ways in which who they are and how they are impacts what they might do next in looking for support inside of their status. Mental health care practitioners, it's always good to have an integrated care strategy or technique or partner that might help to encourage or reframe how you even have your own thoughts around the stigma that comes with HIV and HIV care and the traumatic events that your clients may be encountering. For individuals who might be worried about their status, that might identify as HIV positive and undetectable or detectable at this point in time. Well, my encouragement to you is to prioritize your mental health, even in the smallest of ways. That might mean that as you're finding and exploring and understanding what the status means for you, perhaps it's also time for you to say no, to walk away from things that have been unhealthy for you in your life. Take time to meditate and to breathe. And maybe talk to a trusted partner about your experience and what support you might need. And partners, families, you're just as important too here. Do the work to understand HIV and AIDS and the impact historically and presently that it has on one's own process of being able to explore and to feel heard and to feel seen. And absolutely remember that being knowledgeable about information and data and statistics never will supersede your ability to be empathic and to listen and to be present to the needs of others. Your warmth and open arms might be the most healing thing that your partner, that your family member, that your child could need in that moment. And so doing the work, looking inside of yourself, taking the time to be slow and to not act and respond out of fear, but to respond out of love, is going to do a world of good for your person, to make sure that they get the love and the care that they need. And also do your own work. Maybe you will also need a conversation partner to process what it's like to be a partner, to be a caregiver, to be a family member of someone who is seropositive or is undetectable, but has a positive HIV status. So I share all of those things because I want you all to be able to let it out. I want you to be able to talk, to be able to breathe, and to know that in 2020, that HIV is real, that infection rates are decreasing, but we've got to be able to talk about it. And we've got to be able to talk about it with one another in community with one another. And we got to be able to fight, to advocate for, and to stand alongside one another as we diminish and dismantle the systems that stop us from being able to have access to things like PrEP or PEP, so that we can have the care that we need and have access to mental health care practitioners to talk through these things. And we can breathe and breathe and breathe again as we continue throughout our lives to do the good and satisfying work of just existing on this world. So with that, I'll end today. And I'll tell you thank you for your time and for your listening. And if you have any questions, you are welcome to email me. My email is marlon.johnson@ssw.edu. Thanks so much, and I hope you enjoy the rest of your time in this conference. Take care.